Hi, my name is Emmanuel Cruz Carrasco. I'm going to read the theory and exercises of Chapter 24, Infections, of the textbook Professional English Use in Medicine. A. Fever. A medical student has made some language notes on a case report. Case 45. A 24-year-old man presented with a fever which he had for 3 days. On the third day, he had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever, infection with Epstein-Barr virus at the age of 18 years. He had returned from Africa 3 weeks previously. Now I'm going to read the student's notes. Fever, pyrexia. Also remember, PUO, pyrexia of unknown origin. Fever, also known as temperature. I have got a temperature. Adjectives: feverish, febrile, and pyrexia. Opposites: afebrile, apyrexia. Some symptoms of fever: sweating, rigors, severe shivering, and sensation of coldness, also known as chills. B. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria, that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many non-infectious degenerative and chronic diseases. Communicability is another factor which differentiates infections from non-infectious diseases. Transmission of pathogenic organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, by vaccines, especially like attenuated vaccines such as rubella vaccine, or by drug prophylaxis, for example, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Notice the common expressions for acquiring an infectious disease. Could he have caught, picked up some disease from the dog? I think I have caught the flu bug that's going around. C. Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in the throat, for example, diphtheria, bowel, salmonella, or blood, hepatitis B, or HIV. Non-human sources of infection include water, e.g., cholera, milk, e.g., tuberculosis, food, e.g., botulism, animals, e.g., rabies, birds, e.g., psittacosis, and also the soil, e.g., Legionella, Legionnaire's disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Now I'm going to read exercises of chapter 24, Infections. 24.1. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1. 1980s saw the UK launch of lab-attenuated measles, mumps, and rubella (MMR) vaccine. 2. Chickenpox, varicella, is a common infectious disease of childhood. 3. Rabies has an incubation period ranging from 4 days to many months. 4. The patient remained febrile with peaks of temperature of 39.5 Celsius. 5. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. 6. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic of AIDS. 8. Measles rubella is most infectious during the Catarrh stage. 9. Lyme disease is caused by transmission of B. burgdorferi from animal to man by exotic ticks. 10. PUO stands for pyrexia of unknown origin. 24.2. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 beats per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking chloroquine regularly. The diagnosis was confirmed by the presence of protozoa in his blood film. 24.3. Complete the sentences. Look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms or microbes. 4. Someone whose temperature is normal is afebrile. 5. The common infection with Epstein-Barr virus is known as glandular fever. So that was chapter 24, Infections, of the textbook Professional English Use in Medicine, Theory and Exercises. Thank you very much for watching this video. My name is Emanuel Cruz Carrasco, and that was the video.